Namaskar, good morning, and a very warm welcome to the day three of APAC Smart and Sustainable City Conclave. We are standing at the day three of this 3 day conclave. We had it has seen the participation of close to 20 state governments, Government of India, and over 2,000 delegates. And this particular conclave not just had interesting panel discussion and technical presentation on smart cities, sustainable urban development, and various other aspects for eco-friendly urban development, but also various companies and corporates which are providing solutions, services in these urban ecosystem have put up their uh, solutions in the virtual stall. We have a very special virtual expo where many of the organizations have put out their solutions. Many of the delegates have visited and interacted live with our individuals who have manned the stalls. Now, today we are having some special, interesting sessions lined up even for the day three. Just to give a brief about the day one, we had the inaugural session inaugurated by Dr. Vishwas Mehta, who's the Chief Secretary for Government of Kerala, and we also had representation by smart city CEOs from across the country. And in the day two, we had a keynote address from the Government of India, Mr. Durga Shankar Mishra, who's the Secretary, Ministry of Housing and Urban Affairs. And we also had representation, a very interesting session on tourism, how to go for the untapped potential of tourism. We had decision makers from the state of Odisha, Principal Secretary, Madhya Pradesh, Principal Secretary of Tourism, and also from Gujarat and of course Kerala. And today, now we shall do one of the important elements of the urban development and sustainable urban development and smart city, that is smart health and the health ecosystem in the urban area. So let me introduce the special guest of today's opening ceremony. She is a creative person, and she's a dancer, she's a writer, and she's also an author besides being an actor. And besides that, she has done some extensive work as an IAS officer. She's the 2014 batch IAS officer. Currently, she's holding the position as the mission director for Ayushman for the mission Ayush in the state of Kerala. She is also the mission director for Mahatma Gandhi NREGS scheme in the state of Kerala. So please join me in welcoming Dr. Divya Iyer. Thank you very much, Dr. Divya, for joining us.
Namaste. Thank you so much. Congratulate APAC News Network for all the wonderful thought exchange programs that you have been creating, because as you say, connecting and communicating is inevitable to creating changes in our society. So without much ado, let me get in to the topic for the day. I'm extremely honored and privileged to be a part of this Smart City Conclave that's happening in Kerala through this virtual platform. And talking about urban health, I think I'm instantly reminded of some of my studies that we had done as a medical student in CMC Vellore, in Christian Medical College Vellore. So I remember the study that we had done in one of the urban slums in Vellore, which was actually peer-reviewed and published in the International Journal for Psychogeriatrics. The study was very simple. It was to try and figure out the prevalence of depression amongst the elderly population in urban areas in Vellore district in Tamil Nadu. The process of actually going to the urban slums and talking to each person in the household and trying to administer the 2Q questionnaire that we had devised. It was a very simple questionnaire which consists of just 2 questions instead of the routine, 30 odd questions that we would administer to detect or screen for depression. This was a new method that we were trying out. I'm not trying to detail the entire study to you right now, but the cardinal lessons that I learned from that was this. The result of that study revealed that there was a whopping percentage of undetected depression that was prevalent amongst the elderly in the urban slums in that district. And number two, when we interacted, as medical students, we have more time and probably more leverage in order to get into the households and connect with the family members and talk to them and understand their problems rather than just administer questionnaires. So in that whole process, we realized that there is a huge burden of hidden illnesses that is actually lying around in the corners of every little household in our urban areas in India. Now, I'm not talking based on just that one study's experience that I had as a medical student, but from that point onwards, I've tried to keep a keen eye on what actually lies beneath the obvious, especially when it comes to the health sector in urban areas. And I'm certain that all of us would agree that the concerns in the health sector in urban area definitely differs from that in rural area to a large extent. Of course, there are overlapping centers, there are overlapping areas and fields of concern across the board, but definitely there are certain unique patterns of diseases, of disease burden, as well as other challenges faced by the healthcare sector in urban area. The example that I gave regarding the 2Q questionnaire which we administered in order to detect the prevalence of depression amongst the elderly in the urban slum was just a tip of the iceberg. I'm certain that if we actually go out to do a massive surveillance process or to do a massive screening process in urban areas, we would detect a whole lot of hidden disease burden. And that is where I would want to start this talk and provoke your thoughts with. When we are talking about building smart cities, we are also talking about building healthy, smart population. It is hardly about infrastructure as it is about the functionality and vitality of the people residing in those cities. And that is where health definitely comes in to play the key role in building smart cities. So as we go ahead making plans for our smart cities, it is inevitable that we create spaces and use technology in the appropriate fashion in order to build a healthy and smart and vital population to add value to those cities. And this is where the first example that I gave comes in very handy. Because this whole process of screening and surveillance for diseases becomes the foundation of building a healthy population in urban areas in smart cities. And in order to ensure that we do proper surveillance and massive screening, we definitely need to devise simple methodology in order to reach out to the last person at our hands reach and beyond. And this is where technology comes into play as well. When I talk about technology, it is not just devices and automation. Every single methodology that is used in research study is a form of scientific technology in one way or the other. And when it comes to technology, in healthcare sector, it is all the more diverse because in healthcare sector, the technology ranges from anywhere between we have an e-Sanjeevani, which is very active in the country right now, which is an online portal in order to take appointments with your doctor, and it offers online prescriptions, and there is no need for you to actually move from one place to another almost. So that's one thing which is actually going on very well in our country, including Kerala, which is an online consultation portal. So, we're talking about things like that, to even robotic surgery, right? So when we talk about technology in healthcare, these are the things that comes to our mind first. But when I'm talking about technology, it is not only these that I'm talking about. It includes everything from robotic surgery to a sanitary napkin vending machine that is installed in a school or in a public place. Now, that is the right use of technology in order to ensure proper healthcare facilities and foster a healthy population in a smart city. So, it is not enough to talk about automation, it is not enough to talk about AI, it is not enough to talk about robotics, it is not enough to talk about online platforms for consultations and prescriptions and e-health, etc. We need to start talking about the ground reality. We need to start talking about what is beneath the obvious, what lies beneath the surface. For the screening and surveillance, as I said, forms the foundation. And for this, we need to devise methodologies and techniques in order to attract people to probably indulge in a self-survey, or use technology in order to actually administer these questionnaires, have kiosks. We can have surveillance methodologies. There are umpteen number of surveillance methodology in epidemiology. I need not really spell out everything here at this point of time. The right people definitely know all of them. But when we are talking about smart cities, it is important that we give adequate space for all these methodologies and techniques which ensure a proper massive screening and continuous monitoring and surveillance of the health status of its population. As I said, people could definitely indulge in a self-survey, which could be administered online, or you could have Akshaya centers, you could have kiosks wherein people could go and take their own healthcare vitals and health status and fill up a questionnaire, or just, at the tap of a few buttons, probably we'll get the details of people's health sector as well. So that is my first request and pointer towards anybody who is working in smart city projects. Now, as I mentioned, it is not only robotics and AI that we are talking about, but it comes down to the wire, wherein the most important and arguably the missing factor or the missing link in our healthcare chain is what actually happens at the grassroots levels, which is not obviously, it's not very obvious that a sanitary vending machine need to be allied to healthcare sector. Somehow that link has not been made very obvious in our country till date, right? So when we are talking about Swachh Bharat, when we are talking about cleanliness, when we are talking about waste management protocols and waste management facilities, that is one of the most crucial elements that actually contributes towards healthcare sector and proper building of smart cities in our country. And this cannot be done in isolation by the health department. Right from our social justice department to our education department to the most important player in this game, which is the local self-governing bodies or the local self-governing departments, our Panchayati Raj institutions and in the rural areas, and the municipalities and corporations in the urban areas. So these are the key players in this aspect, wherein the foundation for proper healthcare administration and proper public healthcare delivery is actually built and maintained. Let me try and explain this. It starts from maternal health and childcare and nutrition to proper waste disposal. Now, all these factors, as I said, can be done only in convergence with the other departments. So the key to building a healthy population is 1, have proper screening and surveillance techniques. 2, foster healthy habits amongst people. And in order to foster healthy habits amongst people, it is inevitable that we use technology of the right sort at the right place for the right reasons. Having proper nutritious food being delivered at every Anganwadi is probably the most effective intervention as far as nutrition and growth of a healthy population is concerned. Early detection and prevention of anemia especially in women, in girl children, is one of the most crucial things that one can do in order to foster a healthy population. Now, even if we just focus on these two aspects, just focus on nutrition of children and adolescent girls, I think half our job is done as far as raising a healthy population in a smart city is concerned. And in all these, it is not as if we have not identified our loopholes, it is not as if we have not identified our lacuna, but somehow we have not been able to reach out to the right person at the right time, in the right manner. And this is where we need to utilize technology in order to deliver proper and effective public health care. As I said, it involves schools, it involves Anganwadis, it involves families, it involves local self-governing bodies. Everything from nutrition to waste management actually forms the basis and the foundation of building a proper healthcare system, especially in an urban setting. And this is something which again goes off the radar in many a city. And this time, when we are actually building smart cities, I'm certain that we shall not lose our focus and ensure that we have proper systems of convergence that is built amongst these various departments and even more for that matter, to ensure that proper healthcare setup is actually built on a very robust foundation. And once we do this, we can see that this whole process of fostering healthy habits amongst the population actually comes a long way as far as our health indicators go. Whether it be our SDG, our Sustainable Development Goals indicators, or it be our national health indicators, at all juncture, if there is one reason why the state of Kerala has moved far ahead in achieving good results in public healthcare delivery, I would say the only reason is because we've actually worked on our health-seeking behavior of its population. As I mentioned, it is not just enough to build systems and structures. It is not all about infrastructure development. It is about making our systems functional and ensuring that the deserving population actually gets to utilize those functioning systems. So we have to see two sides of the coin. Very often, we build good hospitals, we have the right amount or the adequate amount of staff to run the hospital. But what is the use if the person who is falling sick is unable to reach the hospital on time? What if the person who is falling sick, who is in need of healthcare, does not even realize that he needs healthcare at that point of time? Now, this might sound very silly, but when you go to the root of the problem, when you go out there in the field, very often you realize that it is the health-seeking behavior of a populace that becomes the game changer in achieving really good and encouraging healthcare indicators. For in this state of Kerala, I'm certain that every mild illness deserves and manages to capture the attention of the person who is falling sick. Plus, they ensure that they seek healthcare at the right point of time. You hardly find people who actually sit at their own, in the comfort of their houses saying that it's okay, I'll get well in a few days, let me take a few more days to go and consult the doctor. That kind of laziness in actually approaching the healthcare system is very rare in the state of Kerala. People are very vigilante about their health. And that, I think, is extremely essential in an urban healthcare setting. Because as I said, the healthcare system in urban setting is not as robust as probably what is there in the rural setting. The public healthcare system in the urban setting is often not as robust as that in the rural setting for a couple of reasons. One, the numbers are very often overwhelming that it becomes difficult for the public healthcare sector to reach out to the last person who is in need. So it is important that that person actually comes back to the system to seek healthcare. It is not a one-way traffic. It is not a one-way journey. It has to be an exchange of information and exchange of needs that need to take place in an effective urban healthcare system. So it is not enough that the public healthcare system or the government or the private players actually reach out to the last person. It is also important that the person who's actually in need comes back to the healthcare system seeking help. So in order to ensure that, we need to alter the health-seeking behavior of our populace. Now, this can be done, again, by using effective technology and methodology in order to reach out to the population, not only to deliver healthcare. This reaching out, I'm talking not about delivering healthcare, but about generating awareness and about altering health-seeking behavior. To tell people as to when they need to see a doctor, when do they need to visit an OPD, a clinic, when do they need to go to a hospital, and which hospitals are around them, how do they call up for an ambulance, who is the first person, who is the first responder for their needs as far as their healthcare concerns are concerned. So, each and every of these minor things, as I said, it might sound silly to some who are already well established in the healthcare sector, but trust me, when you go out to the grassroots and interact with people, we realize that these are the factors that actually becomes the game changer. And if we can ensure proper awareness of all the possible health concerns that a common man needs to be aware of, we can definitely bring about a change in health-seeking behavior. And this cannot be done in isolation. Of course, we have, information technology is booming in our state and in our country and across the globe. So the perfect use of technology would be to actually create awareness and alter the health-seeking behavior to a more robust and a more encouraging and a more timely one in building of smart cities. Now, this will definitely, as I said, go a very, very long way in our building of smart cities, as well as fostering a healthy population in our smart cities. Now, there have been several surveys which has been conducted in our country, which actually measures the health-seeking behavior of our population. And interestingly, I think in the NSSO survey that was done in 2017, or the 71st NSSO survey, if I'm not mistaken, it actually showed that people in urban settings seek help or healthcare services from Ayush centers in a much more generous fashion or much more frequently than their counterparts in the rural settings. Now, this it probably comes as a surprise to many, because people think that indigenous and traditional and herbal remedies and practices are mostly popular in rural areas and not in urban areas. But in several states and across the country, even the national average, when they take 85% of the rural population who were part of the NSSO survey, were seen to avail Ayush services, especially homeopathic services as well as Ayurveda services in urban areas, as compared to those in rural areas, which stood at a 70%. So there was nearly a 13 to 15% increase of utilization of Ayush services in the urban areas. Now, as I said, this also comes in as a part of the awareness generation campaigns that are done in urban as well as in rural areas. Also, there could be another reason which was pointed out in the survey, which is a change in the pattern of the diseases in rural as well as urban settings today. As we all know, due to the overwhelming population or the booming population in the urban areas, as well as the kind of air quality and the kind of disease burdens and the kind of lifestyle and the food and environment that is actually present in the urban areas, the kind of diseases that afflict the urban population is also extremely different, is becoming extremely different from that in the rural areas. Now, this could be another reason why Ayush services are becoming more and more popular in our urban areas. Because when I talk about change in pattern of diseases, you would definitely know without me saying that I'm hinting at NCDs or non-communicable diseases, which is growing at a much faster rate than what we expected in our urban setting. So when we're talking about lifestyle diseases, when we are talking about chronic illnesses, we are talking about diabetes, we're talking about hypertension, we're talking about cancers, we're talking about a lot of lifestyle diseases which require chronic treatment or which require long-term or even a lifetime of treatment. Now, in this setting, very often people are seen to avail Ayush services, and there are a lot of lifestyle modifications that is actually possible through imbibing the essence and practice of Ayurvedic services, whether it be Ayurvedic lifestyle, whether it be a healthy diet through naturopathy, whether it be a healthy lifestyle through exercise and yoga, or especially in pediatric age group, we see that homeopathic services are very, very popular. Probably also due to the reason that the medicines are much easier to administer in pediatric age group. The homeo medicines are much easier to administer in pediatric age group. So these could be like small factors, but actually they make a big difference when it comes to availing health services. And definitely when we're talking about health seeking pattern, all these has a role to play. All these factors have a role to play. So availability of Ayush services in urban setting again comes in very handy in order to improve your health seeking behavior of the population, as well as offer a cafeteria approach towards the urban populace. It is also seen in several studies that urban populace is often longing for many more choices in every walk of their lives. As we all know, we have kirana shops, we have small little shops and grocery shops in our rural areas. But when it comes to urban areas, we have huge supermarkets, wherein there are probably 30 varieties of soaps that are available for us to go and pick one. So urban population is often used to that kind of choices, and it is important that in health sector as well, we provide them with the right choices. And we also make them aware of what is available for each disease that afflicts them, for each health condition that afflicts them, and what is available for prevention of these diseases as well. Now, again, at that point of time, Ayush becomes very important and has a major role to play in prevention as well. Especially as we are talking today, we are talking also about the COVID scenario that we have, and we are in the middle of a gripping COVID pandemic here, and it's actually in Kerala, we have had a huge level of success in administering Ayush medicines and Ayush interventions in containing the COVID scenario as well, in containing the COVID pandemic as well. So we have several programs which administers preventive medicines, both in homeo side as well as in Ayurveda side. We have a Swasthyam program, we have a Sukha Ayushyam program, both of which for people less than 60 years of age and more than 60 years of age, preventive medicines are given for the COVID illness, COVID-19 illness. And this we have, actually administered to the tune of put together, we have administered to the tune of around 10 lakhs. People have been beneficiaries under these. Similarly, we have homeo preventive medicines for COVID, which has actually gone to the tune of around 2 crore beneficiaries under this COVID pandemic scenario. So, on the preventive side, actually, Ayush has got a lot more to offer. And this is also a part of generating awareness as well as reaching out to that last person in the urban setting, which would drastically alter the health-seeking behavior as well. So, as we talk about lifestyle illnesses, it is also important to talk about another very unique problem that we would have to handle in smart cities as far as health is concerned, which is accident and injuries. So, no city can get away without dealing with road traffic accidents and injuries. So, a proper and a brisk and swift response mechanism to accidents and injuries is a must in any smart city. Now, this is another place where technology comes in really, really handy. And unless we use technology to the fullest, we will not be able to contain the everlasting pandemic of accidents and road traffic injuries in our populace. So again, from awareness building to well facilitated ambulances to not missing the golden hour, there are so many crucial steps in this whole process of containing accidents as well as road traffic injuries. Now, that is another area which can be, a session in itself, but I thought I would be remiss if I do not mention it while talking about the disease patterns and the changing disease patterns in our urban areas. So, these are the three major points that I wanted to raise in today's talk when we are building smart cities at a lightning pace and ensure that we foster a healthy population as well. So the first one that I mentioned was about the hidden problems in our cities and how massive screening and surveillance is essential and how we could actually use technology effectively, attracting people to indulge in a self-survey of some sort and, conduct a massive screening process and ensure that we use technology to continue the surveillance process. Though, because this is important because it's going to be a floating population in an urban setting. So it is important that we continue the surveillance practices as well. And secondly, we spoke about how a model of convergence in building health system is extremely crucial. It is not just the health department that's going to come into play. The foundation of good health is to foster healthy habits amongst people, a healthy lifestyle amongst people, and for this a convergence between the local self-governing departments, the education department, the social justice department, the women and gender department, and right from Swachh Bharat to as I mentioned, providing sanitary napkins to ensuring proper nutrition to children and adolescent population. Everything actually forms the key formula or the secret formula towards building a healthy population in a smart city. And the third point that I mentioned was about health-seeking behavior, how crucial it is, because in urban setting, it may not be often possible for the health sector to reach out to the last person through the public healthcare system. So it is important that we spread awareness and make sure that the person reaches out to the healthcare system as well. And it needs to be a continuous exchange of information and services between the provider and the beneficiary. And the fourth point was about the changing pattern of diseases that we see in our urban setting, and how Ayush services actually come into play and has turned out to be actually very important and a preferred mode of service for people in the urban setting, mostly owing to this changing pattern of diseases, which is tilting towards more lifestyle diseases and accidents and injuries as well. And in this, in all these 4 points, how effectively we can use technology in order to ensure that nobody is left behind in this whole process of building a comprehensive and a healthy public healthcare delivery system and fostering a healthy population as well. So let us try and utilize, every bit of our human resources and every bit of our technology as well as cooperation to ensure that we raise a healthy and smart population in our smart cities as we move ahead. Thank you so much for this wonderful opportunity, and let's hope for a smart and healthy tomorrow.
Thank you very much, Dr. Divya Iyer, for sharing those insights. You have mentioned some new terminology. I would say that, of course, you said the health-seeking behavior, and you also mentioned about the cafeteria approach towards Ayush centers. For all these, there is a very strong synergy that is needed between the urban development or smart city team and also the health department team. Do you see the challenges that are existing in the present times?
I actually mentioned the convergence part to indicate this. So, it is important that we actually work hand in hand, not just between the health department and the urban development department, but with every other department that comes into play. As I mentioned, right from our local self-governing bodies, which probably are the most crucial element in building smart cities, and even the private players for that matter. It is not only the government systems that are going to help, in urban settings especially. So a synergy needs to be evolved between all these important stakeholders, and especially within the government, definitely a convergence model needs to be developed, and that is the only way in which we can actually sustain this project forward, because building a smart city is not a one-time activity. It is
Yes.
something that needs to keep on rolling. We need to
Okay.
keep the ball rolling, and for that, it is only the convergence mode that is actually going to help us between all these departments that I mentioned, and even more perhaps. So that I think is very crucial. Yes, it is a challenge, but in the changing times, especially with effective use of technology, I think we are definitely able to interact and communicate with each other in a much more seamless fashion, and that I think will definitely foster new openings and new avenues of convergence, not just within the departments, but as I said, with our private players, even with our beneficiaries for that matter. We have actually moved on from this concept of government is the provider and public is the beneficiary or the recipient. We have moved on from that concept. Now we are all equal stakeholders in this whole process, and we are building a healthy population in a smart city. That's why I specifically mentioned about the hidden elements, and I mentioned about the how it's important for people to come forward, and not really for the government to
Yeah.
go to them only. So that's where the health seeking behavior and the healthy habits fostering, all that comes into play. So they are the most important stakeholders in this whole project. I think people are the most important stakeholders, and so it is important to take them on board, and to the least we can do is to ensure that we give them a good and healthy lifestyle and a good environment for them to live in. So,
Absolutely, as you rightly said, Dr. Divya, that a city cannot become smart without with the unhealthy citizens, and at the same time, it makes lays the foundation for a sustainable growth of urban space, and at the same time. If we move a little from the e-health part of the urban space, you are also the mission director for Mahatma Gandhi NREGA in Kerala.
yeah.
Would you like to tell us how this particular scheme is contributing towards the sustainable urban development, or any synergy that's happening?
Yeah, as the name suggests, Mahatma Gandhi National Rural Employment Guarantee Scheme is actually confined to rural development, but indirectly, definitely, it does foster urban development. One, for example, in Kerala, Mahatma Gandhi National Rural Employment Guarantee Scheme has served as a huge inspiration and a model for a similar scheme for employment to actually spurt in the urban area. So, in the state of Kerala, we have an Ayyankali Urban Employment Guarantee Scheme that is modeled on Mahatma Gandhi NREGA, and which is doing quite well. So building infrastructure in urban setting is actually happening under this Ayyankali Urban Development Scheme, Urban Employment Guarantee Scheme in Kerala. So definitely in that way, it is indirectly, contributing towards urban development. But the other factor, which I think is not as drastic, but it is a very gradual process that is happening, which is a continuum of the Rural mission that we have. It is actually a concept from the Rural mission that I've taken, I think, because through infrastructure, through rural infrastructure development, which is happening via Mahatma Gandhi NREGA in our rural places, we are actually taking urban to the rural. So there is rural infrastructure development that's happening on a massive scale under Mahatma Gandhi NREGA today. So much so that we are actually taking urban amenities to rural areas, which is like the famous Pura model, which was suggested by our late president, Dr. APJ Abdul Kalam. So it is more or less the rolling out of the Pura model that's happening, because instead of that actually contributes towards urban development as well, by reducing the influx of migration of migrants from rural to the urban area without any constraints. So if we can prevent massive influx of people migrating from rural to urban area without any planning, I think that will be a huge contribution to urban development in itself. And also at the same time, through rural infrastructure development, we are taking the urban to the rural through Mahatma Gandhi NREGS. So I think that continuum, the rural-urban continuum, is actually becoming more and more seamless because of both these schemes.
Glad to know, Dr. Divya, about the contribution. There is a kind of urban populace going towards the rural for infrastructure development. So now, as you are aware, this particular conclave is being hosted by Smart City Thiruvananthapuram Limited. Mr. Balakiran is the program chair, and of course, Government of Kerala, and Mr. Dr. Vishwas Mehta is the chairman for this particular conclave. Thank you very much, Dr. Divya, for joining us.
Thank you. Namaste. Keep up the good work.